Good afternoon, ladies and gentlemen. I'm Prabhakar. In today's conversation, I have Dr. Anand Naragani, and Dr. Anand is one of the leading orthopedic surgeons in Hyderabad with over 17 years of experience. He did MBBS from University of Mysore, MS Orthopedics from Karnataka University, and MCH from UK. And apart from his qualifications, what I can personally introduce him is that he is one of the very jolly and fun-loving doctor. And when you talk to him and when your patients talk to him, it doesn't look like as if they are talking to the doctor. He puts them at ease, and of course he's a master of his profession. Yes, welcome, Dr. Anand.
Thank you. Thank you. All well, all well.
Coming to your medicine, is it your first option, or you wanted to do something else and then become a doctor?
I was into computer science. 86, I joined medicine. Okay. In 84, computers were a big thing, and computer 84. Okay. 83, 84 time, that is the time when my computers were coming in, and then I joined computers and learned all that. Then my father said computer science is okay. My father is a doctor, he's an anesthetist. So he let me pursue it, and then I was writing my SAT exams to go foreign because my school education was always abroad. It was in the Americas. Okay. So I was going to join computer science. Then he suddenly realized that this is an engineering college and an engineering subject. Okay. He didn't think that it was anything to do with something. He thought it was like a science and all. Okay. Then he said, "No, you can't. You have to be a doctor." I said, "No, I'll be a doctor through the computer." And that time it was just starting. So I'm an accidental doctor.
Okay, that's good.
That's how I would look at it. If you ask me such a specific question, things changed for me. That's
okay. But why I asked this question is going by personality. I thought you wanted to become an actor, then became a doctor.
No, I didn't want to become an actor. Probably.
So now coming to the orthopedics, why did you choose this as a specialization? Is there any specific reason for that? Or you thought of some other?
No, after I finished my MBBS, my father is an anesthetist, so I wanted to do anesthesia like my father. And my father, and he was a good anesthetist, and he was abroad, and it was good science, and it's a very brilliant science because they have a gamut of knowledge of every specialty. The anesthetist puts you to sleep and almost, he keeps you to sleep and gets you. So that physiology, that everything was it's a wonder. My father said, "Look, no, you have to be a surgeon." Okay. I said, "Why?" So anesthetists, we all take the patients down, we take care of the ICUs, and there's no much recognition in what we do. Exactly. And it's the surgeon that takes the recognition. I said, "Dad, I love the science." He said, "It doesn't matter." He said, so he was one way pushing me towards surgery. And then after that, specialization came in. So we chose orthopedics maybe because of the personality. It just happened. Orthopedics just happened. Otherwise, I would have been a cardiac surgeon also.
Okay. Now coming to the various streams of medicine, in a lifetime, we may or may not go to many doctors. Like I never gone to a ear specialist, but normally in a lifespan of time, there will be hardly any person who doesn't visit a orthopedician. Why it is so? No. Can we avoid it?
Well, see, the basic thing is this: you find hospitals and doctors are plenty, right? So we have a small joke. If everybody in the world has body-mind harmony, when you have body-mind harmony, the places I work in should shut down.
Yes.
If every human being has body-mind harmony, how do they get body-mind harmony? You can do yoga, exercises, meditation, things like that. You get body-mind harmony. Now we see that there's not much of body-mind harmony. People are coming to the hospitals. Yeah. As an orthopedic surgeon, my job is to make people move. And what brings me to work is the motto that life is movement and movement is life. Yeah. If you go to a heart doctor, they'll say walk, walk.
Yeah.
And the purpose of life, maybe in a way, in different, is to move. So without movement, there is no life. And you need those two legs to walk. And yes, the orthopedic surgeon has my importance. So I tell myself, I'm here to make people move around. Not around, at least in their own house.
Yeah.
So we don't say any human being should get out of their bed, go to the dining hall to have a meal, and go to the toilet, and then sit in the hall and come back. These little movements after a certain age should always be there.
That's good. Now, when a child is born and in his growing stages, is there anything we can do to make his bones and joints strong, or is it to be left to natural
No,
growth?
children are play. Children naturally play. They jump. So that jumping and playing makes their bones grow stronger. And the nutritional aspect, it is one how they actually do their activities and what nutrition is given by the parents or whatever he eats. Now there is a tendency to there's so much of information around in the world right now with Google, yes, and everything. Yes, calcium products and those that the optimum carbohydrate, optimum protein, fats, minerals, and that is, it's a standard. So I don't need to go on that, but from my perspective of activity, they should play games, and that's why in the curriculum of every school there is sports, and sports only. Sports doesn't mean you'll be a sportsman champion. You just can do skipping, running, jogging, whatever, playing. That increases the height of the patient. Okay. So if you are a lazy person, you become, you can increase your height from beyond genetic level by activity. Genes will give you one height, but you can go a little more by activity. So children, they just have to move.
Okay, you almost answered my next question. Does any kind of specific exercises are there to strengthen your bones and
for children it's different. They keep jumping, and that they need. Every person below 15-20 years, they jumping, right? They jump, run and all that stimulates bone growth. Okay. Now once you're after 18-20, there is no such thing as more growth. You stop growing after it. That now is called maintenance. Maintenance is usually it sustains to that, but as you get older you become inactive. Okay. Activity is necessary, so therefore you are expected to walk around, you must move, and movement causes some sort of a stimulation for the bone to stay stronger, your muscles to stay stronger. Otherwise there's something called atrophy. Atrophy of the bone is called osteoporosis. Atrophy of the muscle is called atonia. The muscle starts to weaken, and only if you're moving. So life has a purpose. If you sit at one place, you will deteriorate. So therefore movement for everybody is necessary, and we don't expect an elderly person to jump. We ask them now to do yoga and walk and walk. Some people ask brisk walking, what is good walking? Just walk as much. Keep walking, and if you want to do your brisk walking, if you are able to do it, do it. But as you get older, you can't brisk walk. Yes. So there are so many ratios. After 60, what do you do? After 70, what do you do? After 80, what do you do? So each one, there is so much of information, but you must be active only.
We talked about exercises and movements, other things. People who don't do that and who are lazy and keep on what happens to their bones? They do become weaken and crack also at some point of time?
Yes, they do. They of course they do. It's a trivial fall. See, we all sit now. Falls. There is a staircase. Our country has uneven footpaths, flooring which are uneven. People move houses. When you move houses, suddenly you're not acclimatized to a house that you were for about 20-30 years, and then you move, and then you don't know where the door is. Suddenly you're consciously. So many factors are there. You can list out all of them. One is the internal factors that we have: our body's blood pressure, our body's strength to stand up, and then we say the environmental condition, the floor, how slippery it is, where the steps, uneven. So all these conditions make you fall. And if you have a small fall, below 50, 60, you may not break a bone. Now, after 60, trivial falls, you make your bones, inadvertently they become weaker. And so there's a fractured hip joint. The ball and socket joint, that is a very common fracture that happens for elderly people. And younger people at the staircases. Young people only have road traffic accidents because of their speed boat, and they break bones which are because of the energy. The force of energy to break the bone is more in a road traffic accident. When you fall, the force of energy is less. So the bones, you should not actually break a bone when you have a trivial fall. So you must keep you might slip and fall. When you have a trivial fall and you've broken your bone, it means you are osteoporotic and cold. That's all. It's osteopenic. In a road traffic accident, 100% you will break a bone.
There is a lot of advertisement about calcium and other supplement medicines. So does taking milk and these calcium tablets and other medicines help in strengthening joints and bones?
Of course, 100%. You can't deny milk. Milk products are good. There are few people who are lactose intolerant. They may not be able to handle milk. But majority of the population, 90% plus, can handle milk, and that is a good source of calcium. We know that from school. Children are taught that. They are encouraged with that. Apart from adding supplements of bone meal, Horlicks or whatever, all these supplements are added because they take the flavor out of the milk, and so parents do give whatever the child to encourage them to have the milk. And milk products, yogurts, paneer and buttermilks and things like that. Advertisement by other good milk companies are saying, please have the milk, and it's a good thing. Only it's a fad now, a veganism, which is vegan people have trying to tell people that there is no perfect formula. Everything is good. And I don't say vegan is good and well. Yes, everything is good and well.
Okay. And now coming to yoga, of course, yoga for thousands of years it is there, and we know the benefits of yoga. But yoga, does it strengthen bones and joints? And it does. If it does, is there any specific asanas you can suggest for strengthening joints and bones?
Yoga is in lying down, sitting and standing positions. So, and there's something called an isometric component, isometric exercises.
Okay.
Standing exercises in yoga, they make you move and jump. There is some jumping in yoga, and that stimulates the bone. When you're lying flat, probably not. But Surya Namaskara by itself, when you are jumping, the movement there is a sudden jerk movement when you take your legs back and then bring it forward, and it flexes the joints, it keeps the muscles in tone, and yes, it does help the bones because the force that you have to have. And there are other in between, they make you stand on one leg. These are, of course, it stimulates the bone.
Excellent, excellent. Now coming to general perception of a personality of a person, normally we feel that a person with a huge frame like you with 6 packs, does their bones are stronger than compared to a person who is lean and lanky?
No, bone quality depends on the nutrition and their activity. Okay. Not on the build. The size of the bone may be different. So in a big build, the size may be a few millimeters more, or centimeters more. The quality of the bone is determined by the nutrition, one, and their activity, two, and probably a little by the genetic activity. So big build people don't need to necessarily have strong bones. They have big bones, but they're not strong bones. The quality of the bone.
Okay. Now, apart from accidents because of which we get injured and fracture our bones and joints, by doing things like lifting heavy things all of a sudden, our sedentary habit, sitting for long hours in AC, does it affect our bones and joints?
Yes, it can. Accidents are different. Now, the bone quality depends on the environment. Yes, you are supposed to be on the sun, but we can't be in the sun nowadays. Everybody is indoors with air conditioning. So, sun rays are supposedly necessary for vitamin D. Now, vitamin D is a very important component of the body. It is not only for the bones, it's for a majority of metabolic activities in the body. Now, that vitamin is created within our skin by an ultraviolet beta wave. There are 2 waves, the alpha and the beta wave. The beta wave of the ultraviolet beam, that is physics, that goes inside our skin, penetrates and divides a molecule called 1,25 dihydroxycholic acid ferrol, which becomes an activated cholic. So the beam goes and turns the molecule a little, and that is the one responsible for absorption of bone in the gut. Calcium, absorption of calcium, and making the bone stronger. Now, they say which is good sunlight. Yoga practices in Eastern culture, our subcontinent, they'll say morning 7 o'clock sun rays are good, the beam. But the scientific community now believes that it's between 11 and 2. Who's going to be in the sun for 11 and 2? And you have to expose yourself. That is not possible because farmers in our country have low vitamin D. They are in the sun for, so the pigment forms. When you go in the sun for 1-2 days, the pigment forms, and when the pigment forms, the beta wave doesn't go inside. So when the original vitamin D was discovered in England, that was a very cloudy island. And then they went to Spain and France, and those days they said, oh, this vitamin is there present in these people in the European subcontinent. And then they said this is sunlight vitamin, and all textbooks in children will say vitamin D is a sunlight vitamin. Little research went on that later, because in our country we have enough sunlight, there is enough sunlight, and nobody did any research. It is only in the last 25 years. This is all talked about. Every living room people are talking about vitamin D and B12, and the doctors are also very flabbergasted to understand what is happening. So farmers, and if you expose yourself too much in the sun, you become dark, you don't get vitamin D. So this optimization, each individual, the sun, timing and all that is each individual. So you can experiment on yourself. You can go in the sun and walk around every other day and get your vitamin D. The test is a little expensive, but still you can have your vitamin D and test it. We have seen that people who are exposed to the sun also have low vitamin D. Now they talk about vitamin D toxicity by taking oral supplements. That's a different chapter. We don't have to worry about it. But that's a myth now. But vitamin D supplements are now rampantly used, and it is a necessity by all departments, not only orthopedics, but cardiology, nephrology, everybody uses them.
Okay, that's very interesting, not known to me at least.
Yeah. It is a necessity. It is a necessary vitamin for nephrology, kidneys, for the heart, many systems, sir. It is. You can read about it on the net.
It's very common these days is of any person of any age, young, middle age or old age, is backache. Backache, severe backaches. What is the reason for the premature backache syndromes and among male, female, working people, or even homemakers?
Broadly, very good. Broadly, let me tell you, back pain is a curse on humans. It's like a two-legged animal should have had back pain once in their lifetime. Otherwise, they have not walked on this planet Earth. Every human being will have back pain. At least once in their lifetime. If they have not had it, consider they have not had walked on the planet. Now coming to that, why? Because the biomechanics are different. Now, I can't ask a four-legged animal whether there is a back pain or not. I mean, that's a joke that we actually have created in biology or zoology, what you say. Now, human beings, when the minute they became bipedal or walking on two legs, back pain has been a curse on man. Everybody has it. Now this epidemiology you talk, male, female, young, boy, everybody along this patient who is resting on the bed for 2-3 weeks has back pain. People who are walking suddenly have back pain. People who lift weights have back pain. People who lift don't have back pain. People who are, see, the first thing that they say is, now the back pain, now we have a classification saying that back pain which is radiating down your legs, which is a back pain which is there in the back area, is called a lumbago. Now that can be due to ligament pain or a muscle pain. Most likely it's a muscle pain. It all depends on your activity, your posture and your daily routine. All this. Now there are books on back pain. It tells you how to sleep in bed, how to get out of bed, how to wash your face at the wash basin, how to pick up something
that also falls down. Back?
Yes.
Washing of the face.
Yeah, when you wash your face at the wash basin, when you're bending forward, you must actually bend your knees a little and bend forward. First thing in the hour, you go and bend and wash, your back catches. So we encourage some people, when you get up, try to move your back. That little school PT teacher yoga, just stretch your back, little move, and then go and bend washing face. So we get a lot of patients. When I started washing my face, I felt a tuck sound. So and then get so worried, and they're frozen at the back. So there's a method to wash your face. There's a method how to get in and out of a car, how to wash how to pick up something
which has fallen,
and how to wear your own clothes, how to put on your shoes if you have to bend forward, and all these are there. Somewhere it clicks. So therefore we encourage everybody to do some yoga at least first 5, 10, 15 minutes in the morning. So the body's now, the joints are all toned for any abuse you may do there through the day. That makes it better. You don't stay away from the doctor.
Okay, good, good. Now coming to the dislocations and fractures which happen unfortunately, and I remember in earlier days we used to have what we call it pailwans and other people. They'll just pull the things, manipulate and put a plasters. And plasters also put in the orthopedicians also. But nowadays what is we are seeing is that more and more they are going for surgeries. So all those surgeries, are they necessary?
No.
Can it be done by plaster, putting plasters?
Do you think there are more surgery? No, I don't. I wouldn't say that.
Okay.
No, a fracture that is, see, that science which is called Puttur science, or in the South India, Puttur was a place. Here in Hyderabad there is something called Sharibanda, there are places like Cape Horn. They are called traditional bone setters.
Yeah, bone setters, exactly.
They're all over our subcontinent and they're there. And some people also even do some chiropractic in that. Now, bone unites as long as you keep it together.
Okay.
Right?
It's a natural phenomenon.
Yes.
Okay.
We don't. By surgery, we are only aligning it properly and keeping it. Now, the bone takes at least minimum 2 months to unite to 3 months in an adult and 1 month in a child. Every bone heals, not every bone. There are very few clauses where the bones don't attach.
Okay.
Now that's a different topic. But all bones unite. Our job is to keep it together. Even a bone setter will keep it together for 2-3 weeks or 4 weeks. And the bone unites. Now we don't want the bone to be crooked enough that it causes him some disability or some handicap. Now that is where we differ, where we say it doesn't have to be so perfect on the X-ray as long as the patient has got no disability. Now if you go to a jarrah or you call these bone setters, you may have a certain disability. You don't call them handicap, but they're disabled a little. You can use the word handicap the way you want it. Now that can cause a little emotional quotient, saying that, oh, my hand is, because we got two things to compare, 2 legs and 2 hands. One is not so good, doctor, I'm able to do this, and this one I'm not able to do. Things like that come up, pop up. So that's why patients probably come over and then say, do you want it perfect? Yes, you might need it surgery. But you want your hand to function, it will function. But as my old teacher used to say, do you treat the patient or do you treat the X-ray? X-ray, you want to treat that, then that is a different science. You want to treat the patient, it's a different science.
Yes, good, good. So now, a lot of times we observe people falling in the bathrooms, sleeping in the bathrooms early in the morning. One reason could be, of course, their floors are very, nowadays, they put tiles and not anti.
No, if they fall in the bathroom, we blame the bathroom.
So, is there any reason that they fall not because of the slippery floors or
when they
water?
turn, sometimes the pressure, there's something called some sort of a pressure drops. And so the brain doesn't get that active flow, and so you lose a little consciousness, and therefore you may lose the balance. So we always say the fault of when a person falls, the fault is only two: within us, or the human body, or the environment. Now, bathroom, if person has fallen, we'll say it's the environment.
It's environment, slippery bathroom.
But it is a combination there, with the slippery or bathroom, when they turn, sometimes they usually fall in that somehow it happens there, and because when they get up from the bed, they rush to the toilet, and that is when the body is not acclimatizing, and so they can fall there.
So what is your advice? Like
when any elderly patient gets up, get up from your bed, stand near the bed, because when they stand up fast, they fall giddy, and they walk 2 steps forward, they fall there. So when you get up from the bed, wait there for a minute, let your system start to get a little activated, the blood flows and things like that. 1 minute is a long time. If you count 60 seconds, get up from the bed, stand up, hang on, wait there. Right? If you fall down back on the bed.
Bed itself, Or you have the support of the bed.
Get that feeling, get that, and then feel that, and then go a little forward. That's one advice we can give. And then, of course, bathroom handicap, you hold on the railings, you can prevent a fall. Fall prevention is one method that everybody is working on nowadays for the architects.
Another biggest thing nowadays, the problem people face is the slip disc problem. So, what is the reason for a slip disc, and at what age normally it happens, and why it has become so common? And is the surgery the only solution for a slip disc?
I say what slip disc, you should take out the terminology, I would say. Slip disc, everybody will have a disc.
Okay.
Now the disc can be a bulge. Everybody will have bulges. There's something called a prolapsed disc. And these are the classifications from our medical terminology. You have a bulge, a prolapse, and something called extruded disc. Now, when does that happen? Nowadays, because the majority of the people are into this computer work, we, for all practical, you've seen people in markets like our Monda market where you see they will lift up 100 kilos or 60 kilos on their back. They don't have slip discs, surprisingly. They have discs, but they don't have a disc which extrudes.
Okay.
Now there's something called extrusion of the disc, which it comes out from its confined space.
Okay.
And it hits the spinal cord, which is right behind it. That's the way it is. Now the slip disc is a problem when you have pain in your legs down.
Yeah.
That is when we call the usually word called sciatica, and we call it radiculopathy. Now there is something called motor and sensory deficit. If you are having sensations of feeling of pain around it, that is called sensory deficit.
Okay.
When you can't lift your leg or toes or things like that, when you can't movement, that's called a motor deficit. And that is 100% surgery.
Okay.
When you can't move your toes,
Yes.
very rarely it happens. But the sensory part, now elderly people do get these. Now we are seeing younger people because they are traveling and they're sitting for long. When you sit for long hours, like we are sitting, discs come out.
Oh.
Sitting job and traveling with that 20 kilos, when you lift it from the suitcases,
Excellent.
we are seeing younger people of 30 years, when they are these traveling people, they are coming for disc surgeries.
Oh.
Weight, that is 20 kilos, and sitting job makes the disc weaker.
Okay.
Standing, walking is good, and the way you lift objects, if you want to lift it from the back, that's why this is where the cantilever mechanism, lifting a child. Now, all these younger people will also have babies. They have babies, so the young people now, the new computer people who are working in this, they are young and they are sitting jobs. They travel, they have their level weights or whenever they're going out, and they have a child which is now 10-15 kilos. They're growing, they raise their child with very bonding emotional that they start carrying them, their discs come out. So they'll say, do you carry weight? No, doctor, I don't carry weight. And then you have a child, the child is 10, and they'll have two children. One is almost 15 kilos and the other one will be coming as 2 kilos or something like that. So they're always bending forward. So younger people having this disc, these are the usual variables of sitting job and having weight to lift. Surgery. That is what a disc is very common in those ages.
But when the post-operation, post-surgery, does the discs come back?
Now the surgery is very, very good. It's just a micro surgery, very small. It's called endoscopy, because we know where to go now. Okay. And the operation theatre technology has become so much that we are guided to that place. Okay. And technology optics have become so wonderful, and the instruments are so good that you can get the patient out walking in the same day.
Okay,
you operate in the morning, you can make him walk in the evening. But that doesn't matter in our country. We'll say, oh, you can wait till tomorrow. Yeah. Because in our in India, our bed charges are not like Western countries. They don't want to do a daycare surgeries. Okay. They are daycare surgeries, but in our country we say, let them hang on, don't worry.
A couple of days, but
couple of days. They won't stay for 2 more days. When they come before the surgery, they always say it's a daycare surgery, no? But they want to stay for 2 more days.
Now coming to post-operation, many times we are prescribed physiotherapy exercises, and most of the instruments used in the physiotherapy are also available in gyms. So even without an accident, if you do that physiotherapy exercises, does it help us?
Then you consider all these as exercises. These machines are there to, one is those people who are not motivated.
Okay.
If a human being is motivated to do their exercises, you don't need a physiotherapist. Okay. You need a physiotherapist to guide them. But a constant guide is for the unmotivated people. And their knowledge is used to make sure that the patient is independently doing their job. Meaning, get up in the morning, walk a little, drink their coffee, or these activities of daily life are trained by the physiotherapist to do that. And yes, you want them to be back and active, yeah. So they want to get back faster. Only lazy people who don't want to get back, we have to push them forward. Those who are not ladies, they'll say they want to go out, but please get out and get up and go.
Okay. Now coming to the replacements, there's a lot of technical advancements as far as the replacements are concerned, like replacement of kneecap and hips and other
that is
things.
arthritis. Yeah, we go from backache, we're going all the way.
Yeah.
Yes.
At what stage one should go for a replacement? Because a lot of people keep on postponing the replacement.
That's good now. As long as they're walking, no.
So what is the stage you really say that now you have to go for a replacement?
When the plate is coming to you and you can't go to the plate that you're eating, you need surgery. If you ask me that direct question, what is the stage? Any human being, every human being should be able to walk in their own house.
Yeah.
So if you want a blanket answer, is when the plate comes to you and you don't go to the plate, it is time for surgery.
Okay.
Don't want that, right?
Okay.
Now, apart from that, it is about your desire. This replacement surgery is a desire surgery by the patient. Now, there are many ways to prolong the surgery. We do not want to do the surgery below 60. We would encourage anybody to come for a surgery after 60.
Okay.
That is just an arbitrary medical knowledge that we use, because we expect that our joints have a lifespan.
Yeah.
Now, a natural joint can go up to 100 years.
Okay.
An artificial joint doesn't have that much age. And so the industry is now trying to push that one knee can take you for 25, 30, 40 years. That's all, experimental in the lab. But how it is used outside, the wear and tear is for every joint. So we give an average of maybe 20 years, 15 to 25 years is a broad perspective depending on when you get the surgery.
Okay.
Now somebody who's 65 years and above will not have so much activity, but they'll be active.
Mm-hmm.
Their joints last longer.
Okay.
Now if you operate somebody who's at 55, they are active. Our own artificial joints wear and tear. You would have to come back for a revision within 20 years.
Okay.
Now we expect a lifespan of 80. We expect a lifespan of about 80 plus for everybody.
Okay.
Our joints, we say 20 years.
Okay.
Now if you operate somebody below 60, now you are hitting that joint to the Prabhakar. So let's say after 60 you get a knee replacement surgery. You can use another word. It is a retirement surgery. And also it is a senior citizen surgery. So when is senior citizen by the government? What is senior citizen age?
60.
60. So senior citizen age. So you don't operate before that. We try not to unless they have got other problems. So this is a surgery which is a wonderful surgery to be done only when the patient says, "Doctor, I can't walk in my house. I'm not ladies, I'm not able to make a cup of tea. I'm not able to cook one meal also." Okay. Yes, that is the time when you have to start deciding, even after doing good physiotherapy, even after taking knee supports or walking aids and medication. So after all that has failed and you know that your walking has come down considerably and you have a desire to walk.
Yeah. That is the most
desire to move. If you don't have desire to move, say the plate is, you like the plate coming to you, then you enjoy your plate coming to you. Right? Don't want to go to the plate, forget it.
Now coming to the post-operation thing, sometimes we see that especially in the operations for the legs, whatever may be the reasons, there is a slight limp, which we observe, and that is one of the reasons people are scared of, going for operations, that it may not perfectly align. Does it really happen, or what is the reason?
These are called balancing issues. The balance, it depends on the weight of the patient.
Okay.
Depends on their spine, how bad their spines become because of the previous of the delaying the surgery. So many issues and variables. But we don't expect people to wait for too long, because the other body changes take place. The spine starts to get a little more arthritic or spondylotic, we say, because that waddling gait, all the stresses fall on the spine.
Okay.
That post-operatively, some people get that locked in their brain and they'll be walking like that only, even though the knee is all right.
Okay.
So the psychology. There are so many factors, and it's too short for us to explain all that. But no, these are good surgeries nowadays done in wonderful places, and all hospitals now. The implants are also good, and there are different implants. People are all saying which is the best implant. You can do it research and talk to the doctor. There is no such thing as a best implant. All implants are good implants.
Okay.
Right? All implants are good. There is no one best.
Okay. Now I understand that a lot of issues with the joints results due to loss of fluids around the joints. So can we do something to ensure that we don't lose fluids around
the fluid? No, it's called a lubricant. They say the inside,
yeah,
inside joint is a lubrication. No, it's not about that. There are lubricant injections and there are medicines now. They encourage their nutritional supplements, are also called nutraceuticals, chondroitins. They are all of them are there.
Okay.
That in all probability they should. It's a nutritional supplement, and they fall in a group called aminoglycans. Also, in my days, olden days, it was called mucopolysaccharides. They are a group of drugs which are their water holding capacity is. They have the water holding capacity. Now, if you want to conquer aging, you have to conquer that molecule.
Okay.
That molecule is in the skin. It's in all these places that hold the water molecule. They are called aminoglycans, glucose aminoglycans. And if we can conquer that molecule, you conquered aging to a certain level drastically.
Okay.
It's a magical molecule. It is only created in the body. It has got some genetic factors of who creates what molecule and how much they create of that molecule. Some people look younger as they're old aging. Some people look older faster before they're aging. It's all to do with this group of drugs in my day. It's called mucopolysaccharides. It's a combination drug, and that is the magical molecule, and that keeps you young.
Okay, that's great to know this thing. And now coming to robotic technology has done wonders in surgeries in all other fields. Has it come in
of course.
orthopedics also?
Of course.
Yes, it is helping you.
Oh yes, orthopedic surgery is like a precision dependent surgery, but a surgeon is good, and a robot surgery is now like an advertisement. We have a robot. Yes, we use a robot. It costs us a little more. Now the advertising, people think that the robot is the best surgery. No.
Okay.
No. It's not like that. It is a tool. A robot is a tool for surgery. A robot is not doing the surgery.
Yeah.
It's a surgeon who's doing the surgery, and the robot is a tool. It's an extra tool. It is not the only tool. There are many tools in the surgeon's gamut. A robot is another tool, and we have it, and it is a high-end tool. And to touch that tool, it costs extra 1 lakh.
Okay.
It's just a tool. Like you're holding a hammer is a tool. A robot is another tool. If you consider that, it's a tool, and it's a good tool. It's there, and every company has different tools are there. Different companies, different robots are there, and different methods. The controller is the surgeon ultimately. Ultimately, the surgeon controls it. Then the robot can tell you if you're going wrong. So that way, you can say, well, my assistant also can tell me if I'm going wrong. If I'm doing the surgery. So there are 2, 3. I mean, it's just not alone. If I'm doing alone, maybe the robot is another friendly person and say, okay, Dr. Anand, you're going wrong. Fine. But now we have so many other doctors who are assisting us, and the 2, 3 doctors, they also know the surgery. So I would say, the robot, he'll tell you if you're going wrong. Of course, we are doing the right thing, and we've been doing it for a long time. So, advantage of the robot, yes, it's a tool for precision, and for me, it can tell me where I'm going wrong, and I can also tell the robot if it is going wrong.
Okay, that's also possible.
Oh yeah, of course, because the robot has some settings, and if the settings go wrong, and it's a navigation system, there are different systems. So, as a surgeon, of course, we will have a gauge where the robot is also going wrong. So now the technology is coming level to level, and maybe in another 5 or 10 years, the robots become much more intelligent. And so, as a surgeon, if I'm just a new surgeon, I'll be there and I'll be taking the robot's help to do it. But the robot will be not the only surgeon. No, you don't let the patient and the robot do the surgery himself. Surgeon is there, is going. That age will not come when there won't be a surgeon inside. It will be the robot and the surgeon. It will not be the robot and the patient. Tell me a date. I don't know. I don't think so. Where there will be a robot and the patient only, and go inside and get an operation done.
So not has to be there.
Surgeon is there, and that's a tool. Now that it's being pushed. I think it's in our country because we are able to bring in technology so much. There are so many other countries which do not have the robot. Of the 200 plus countries, and even in North America, if you go to America, the robot is not there in every place.
Okay.
Robots not being used. If you go and get your surgery done abroad, they'll say, okay, you don't need a robot, and they'll trust them there. Here you say you don't have a robot. You go and see how many hospitals there are in the Western world where they're doing robots. So, if there is a robot, it helps us as a tool. It is a good thing, right? It helps. But don't think that is the only thing we do.
It doesn't replace a doctor.
Not at all. Yes, please don't go by the robotic surgery is not the best surgery, please.
Okay.
We have a robot. We love the robot. It's there to help us. But it's a guide. It will tell me where I'm going wrong, or I will tell it when it's going wrong.
Great. Now, is there any revolutionary research happening in your field in orthopedics, and what we can see in future, which is not there now?
We're trying to I think we're coming to the ultimate because we've given titanium implants, titanium as a super implant.
What is the difference between
titanium and steel? Steel is a little harder, brittle than titanium. Titanium is softer and lighter.
Okay.
So, and we use the word isoelastic, that the elasticity of the metal is as equal to the bone.
Okay.
So it's softer. So these implants are now, because titanium is metallurgy in India has become a higher level right now in physics, in engineering. So we have our own titanium implants. As technology is going on, we say joints are being, new joints are coming where there's reducing the friction between bearing surfaces.
Okay.
We have not conquered the bone implant interface.
Okay.
There is one interface that is it's probably not conquerable yet. The bone implant interface in a joint. Implant interface is what is called, as where you can give it a longevity. Say a joint manufacturer will say 30 years, 40 years it will go on and on. But where the bone attaches to that implant, that interface, we still have a long way to go.
Okay. There will be issues with
it is biology versus organic versus inorganic, meeting point there.
Okay.
Right? We stick it with cement. Whatever it is, that cement, it starts to lose. And there are things, so that way, technology-wise, I think because the robot will still get better, and we are trying to give longevity to everything that we do. We have brought life longevity. The lifespan has increased. Now, whatever lifespan is increasing, your parts of the body should also have that longevity. You take the liver, you take the kidney, they should also have longevity. So we say even the knees and legs and foot are giving you longevity. Okay. Right? So we are all trying to conquer this so-called staying longer.
Great. Now coming to your personal traits, though I met you very few times, but my personal experience and what my sister explains to you about you, you are a very jovial person, and whosoever patient comes to you, including my mother, first of all you try to put them at ease and crack jokes with them. Then the treatment starts.
And I should say,
where you develop this good habit?
Along the way, all along the way in the last 25-30 years. See, 86 I've joined MBBS. Now we are in 2004. So how do you calculate 40 years? Anyway, I finished MBBS in 91 and I joined my post-graduation in 94. So that's almost like 40 years. 40 years in orthopedics.
Okay.
That's the first step, when I joined. And that is, as a doctor, you learn certain things in academics with the professors. Along the way, there are people who come along and try to tell you that you're not the only fellow who heals. There's somebody else out there. I am not a spiritual. I am a spiritual person. No, I'm not a religious person, I would say, but spirituality. There's a healer somewhere. So somebody comes and tells you, says, you're not the healer. There's somebody else who's the healer. And that really hits you. Because when you had the degree in hand, you thought you could cure everybody or take out everybody's pain. And as I went along, my grandfather, who was a police officer, he was a DGP, he was your neighbor to your sister here. So he was one day, as my grandfather, he looked at me and said, you bloody doctors, he said. And the police officer said, what, Tata, what is this, what are you saying? You know, he's been taking his wife, my grandmother, to doctors, and he could go inside anytime because he had that influence to go anytime. He didn't have to wait for the doctor, maybe 5 minutes. He said, patients are waiting for the doctor for almost half an hour to 1 hour.
Yeah.
They're sitting there with the fear of going inside and finding out what the doctor is going to say.
Yeah.
They're really, tensed about it from the time they enter this building, go to the where until the doctor meets. And then after meeting the doctor, you bloody well send them back the same way they came. I said, what are you talking? He said, no, they are coming with sadness or their fear. It is your duty to send them out happily and then have that cheerful experience with the doctor. You are not the healer, he said again. There's another healer.
Yeah.
And if somebody, you can't stop anybody from dying. If you know somebody is dying tomorrow, you don't go tell them you're going to die tomorrow. No, you don't.
Yeah.
Right? So, that depends on which subject you are. We've been a heart doctor or a liver doctor or a kidney doctor. I'm an orthopedic surgeon. My life is very easy. And people come say orthopedics is so simple. I said, look, if you don't walk, life is movement. So if you, I will say it with a joke, Hyderabadi joke is like I used to say, what brings me to work every day? And you used to think, is the heart doctor important or the orthopedic surgeon important? Diplomatically you can say both. And some people very say the heart doctor is more important. Now I say to my own heart doctors, all of them, say you are giving such good life, good heart. You all will say, walk. And then you all need legs to walk. Because if you don't walk, forget about the walking part. I tell my own doctors, I don't give you those 2 legs, I put plaster on your 2 legs and you put you on the bed. Or you're an elderly person, you can't get out of bed. Would you like to live or die? And I said, I'll give it the question to you. It's very, very crudely in Hyderabadi language, you say. And I had a professor who used to say the same thing. He tells the patient, एक ही जगह पे खाना और पैखाना नहीं करना.
Yeah.
You are on the bed. You are using the bedpan there, and then you have a plate to eat, and you're sleeping there. Would you like to live or die? Would you like to live or die? You'd rather go to the toilet there, eat there, and sleep. And you need those 2 legs. Now who's important? Would you like to live with a good heart or 2 legs to walk for this? Tell me. Then I'll say, oh no, orthopedic. So that's why we say movement. And that's why I feel good in my work. And I feel that cheerfulness of saying that you come to make them, you're not making here people to live longer. You're helping them to make them independent. And you try to raise them, because if you don't move, your life will come down. So it's a nice thing, no? एक ही जगह पे खाना और पैखाना नहीं करना.
Yeah, to be jovial and
maybe that's true.
Comfortable there.
We make it. Our job is to push the patient forward, and I see different types of patients, sir, and there are patients who've got cancer, bone tumors. I feel so sad when I see that, and they're young people, and they're not going to live, they're not going to make it. And now we've got doctors who are promising, yes, it's good to promise, but you know where it's going to end. And so I would feel, then tears will run in my eyes. I'm not jovial at that time. But majority of the people who are reckless in their way of having accidents, you laugh at them and say, what? And the next question is, why should bad things happen to good people? And some people come after 70 years, after I've never been to a hospital, never had an injection. I've just come right now. This is the first time. I said, okay, this is the first time. So you have interactions with the patients, and so through my education, along with that, I had experiences in the foreign countries and how they feel, how they are, and I would say that England also made a difference because there was something called a feedback forms. Those feedback forms came from patients. So one day my professor called me and threw some sheet of paper and said, nobody likes you, Anand. And there's a feedback form. The feedback form asked, did the doctor ask you to sleep? Did the doctor knock on the door when he came? The feedback forms I'm talking about early 2000s, even 1990. They were not known to us. Nowadays every hospital will give you, ask a feedback form, did you like it? And there I was like flabbergasted. And I said, oh, I have to change. Is the doctor attire good? I never wore a tie, so you wear a tie. So they'll say, there were questions, and then did they ask you, did you think your treatment was appropriate? So there I scored some marks there, but I scored very bad marks on that side, and I said, you have to change. I said, okay. So that's how my my experiences with other people, understood that I am here to help a few people and I'm also gone. I hope somebody helps me when I'm old also.
Yeah, great, great. Now coming to your personal life, what is your better half does, and are your children following your?
The better half, yeah, my obstetrician. She's an obstetrician. She loves to deliver babies, and that's what she does.
Great.
And my son is a doctor, following in my footsteps.
Very
Hopefully,
good.
yes. My daughter is a lawyer. She works in the High Court under somebody called another firm.
Right.
Yes, she's a lawyer.
Okay, great.
She's working, and he's an orthopedic surgeon, learning to be coming to behind me. Hopefully,
Great.
I can teach him some few tricks.
Very good. What is his specialization? Orthopedic? He's also.
He's coming in behind.
Okay, great, great. Now, when your spouse is a doctor, I think you will have a very good understanding of your demands of the profession.
Yes.
But does that put in more pressure because both are into a pressure type of a job?
Yes, it does. You must have the blessing of the family of parents who are there to look after the children in the first formative years. And so, if two are working, you need somebody at home when they come back from school. So those formative years of our children and getting there where they are, I have to be thankful to our parents who are there to be around.
Yeah.
And now if I had decided to be a nuclear family away from my parents, it would have been a tough job of having some domestic helper waiting for them to come at their times, their food and things like that. So staying, when you are two people working, it makes sense to stay with either of the parents.
Yeah.
Because somebody is there for the children to get back home, and our work hours are so tipsy-topsy. Sometimes my wife disappears in the morning, 5 o'clock in the morning,
To deliver a baby.
and to deliver a baby, and then the children have to get ready and go to school at 8 o'clock. Sometimes I can pitch in. My parents are there. It's not their designated job, but it's a self. You have to be blessed with that. So we were blessed with my parents decided to be with us, and we were always saying you can stay separately somewhere, and they can say it doesn't make sense. I think, and if there are two people working, it is better that somebody of the family member stays there. It's a tip I'm giving people who are two working.
Yeah, great. Now coming to your hobbies, what hobbies do you pursue in whatever little time you have?
I've got many. Now, so first is earlier. I do computers is my favorite thing because I was supposed to do computer science, and so I like to get all the new gadgets that we do with the computers. I do astronomy. Astronomy, I look into the stars. I've got a little telescope that takes my time. I love meditation. I do meditation. I learned the art of meditation we time pass. You don't have anything to do. You just do the meditation. And I play golf as a sport, and then I walk in the park. There are no other contact sports are not wanted, like football. My son plays that. He asks me to play, I can't play all that nowadays. You can kick the ball, but you can't dribble. You fall down. So, yes, you must have sports, find a weekend, and friends are there. We've got plenty of good friends who would like to come and spend time with you. I play golf, so the golf network is a different species altogether. Golfers. The golfers are totally different, and the way of life for them is also different. So I'm also involved with them, and so they give me a positive charge. So things like that. If I'm alone, I either watch the stars or do my meditation.
Great. So that's wonderful conversation, Mr. Anand, and you have been such a thorough professional, and you are so fluent in your answers, and you gave very in-depth answers.
Thank you for actually asking me out. I would say I would actually not do any other interview like this. We said, yes, you're known to the family for a long time, and we're here to serve people, and here the life is very short, and in that short life you have to conquer your ego. That's all. And as doctors, we should have certain, but as I went through, my egos come down slowly. Some people say I still have an ego, but still, you do your job and move on.
Okay. So that is the conversation with Dr. Anand. I hope it's useful to the viewers, and bye for now, and I'll come with some more conversation.
If you have questions, you can ask you and send you, and then we'll answer them.
Thank you very much, and good night.